Good afternoon, sir. Welcome to the 49th Annual Conference of Odisha Orthopedic Association. Today I have with us the Secretary of Odisha Orthopedic Association, Dr. Satya Ranjan Patra, sir. Any of the key highlights of this conference?
Odisha Orthopedic Association is now grown to 750 members, including postgraduate students. So, every year in the second Saturday and Sunday of January of every year, we observe our annual conference, which lasts for 2 days and 1 day of extra workshops of different specialties. So this year also we have organized this, and the organizing team is from AIMS Bhubaneswar. I am the secretary of Odisha Orthopedic Association, Dr. Satya Ranjan Patra. It's a great privilege and honor for me to be here for the first time as a secretary. And this year we have conducted two cadaveric workshops and more five sovereign workshops for the training of our younger generation and young surgeons and PG students. After that, from today morning, we have started with our scientific deliberations, and in this, many invited faculties from all over the country, they are here to share their experiences with our members as well as the young surgeons. And the scientific sessions have been going on with a lot of enthusiasm from the participants. And we have heard our prestigious Professor P.T. Rao Memorial Oration, which is instituted in the memory of the great Professor P.T. Rao, and it was delivered this time by an eminent faculty from Delhi, Professor Sudhir Kapoor, who was a past president of Indian Orthopedic Association, and our founder president oration was also given by our past president, Dr. Saskar Rao. So this way we are going ahead with different sessions, sessions for infection. Then orthobiologic is a new session this time we have introduced. And then spine session is going on right now. After that we will have a real life surgery session, which means our speakers will come up with interesting videos of different important surgeries, and they'll quickly discuss. Within few minutes we'll be discussing about different surgical demonstrations. And after that we will also have few more sessions on trauma, and in the evening we will have our grand inauguration, which will be attended by the president-elect of Indian Orthopedic Association, Dr. Naveen Thakkar, and also our chief speaker will be there. And these programs will go on tomorrow morning again. It will start with a very interesting session, which is the PG paper competition. So this is called the Dr. U.C. Jaina Gold Medal PG paper competition, where students from different institutes, they will come and compete with each other, presenting one paper each, and our esteemed judges will judge them, and one of them will get the gold medal for the best presentation. So this way we'll go ahead. We also have poster presentation, we have young surgeons forum, and many other arthroplasty, arthroscopy sessions will be there. And this way we are hoping that it will be very, very beneficial and interesting for all the participants here, and our younger generation, PG students as well as members, they will learn a lot from these academic activities. It is a great pride for me as the secretary of the association to be involved in organizing this kind of a program, and we are doing a great job till now. Thank you.
Sir, would you like to give a brief insight on the foundation and the working and the growth of the Odisha Orthopedic Association?
Odisha Orthopedic Association is a very old association. The interesting thing is that it was founded in the year 1977, and that year I was also born. So it is as old as myself. So at that time, our founder members, our founder president was Professor R.C. Mohanty. The vice president was Professor P.T. Rao, and our secretary was Professor N.K. Agrawal. They started this association at that moment with many members of that time, when the association was very small and in the budding stage. Gradually it grew, new people came, new professors came, new leaders came, and now we have reached a situation where we have 753 members, and we are also affiliated to the national body, that is Indian Orthopedic Association, and we have more than 300 members in Indian Orthopedic Association as well. And now we have many sub-specialties bodies. As you know, orthopedics has now diversified into different sub-specialties like joint replacement, that is called arthroplasty, arthroscopy, spine, trauma, and pediatric orthopedics, spine. All these things have new. We have subspecialty for different such areas, and they are all affiliated to Odisha Orthopedic Association. And gradually we are going on adding newer subspecialties. Very soon we are coming up with Foot and Ankle Society like that. So this way, our association is really doing great and developing new areas of orthopedics, and we are increasing our academic endeavors so that more and more information can reach our members as well as our students, so that ultimately it will be beneficial for our patients of Odisha.
And so, what advice would you like to give to the students who are pursuing the specialization in orthopedics?
Now there is a lot of opportunity for them now. Previously, when I was a student, used to be a small conference with very limited exposure to faculties. Nowadays, we are having more than 20 faculties in a conference coming from outside Odisha. So it's a great opportunity to learn, to know about new things. Once they know about new things, they will be interested to take up those subjects and go ahead and specialize in those topics. And we also have many technical support companies here who have opened their stalls, and there also we can be exposed to different newer advances of orthopedics. They can go to those stalls, find out new the things like robotic technology and newer generation joint replacement arthroscopy surgeries, and they can take up as their field of interest, and they can become experts in those different fields. So this is a great exposure for all of them.
Thank you very much for your time, sir. Thank you. And congratulations for organizing such a conference which actually promises to be a landmark event. Thank you, sir. Thank you, sir.